Hey everybody, welcome back to the show. I'm very excited because our next guest is going to let me pre-read his new book.
Oh, I've already read it. It's really good.
Well, you're more special than me.
It's coming out April 13th. It is called Of Flesh and Blood, and he is also an ER physician. And today we're going to be talking about sports injuries because the Olympics and Paralympics coming to Vancouver, and nothing quite like watching Olympian endeavors to encourage people to get out there and do far more than they're physically able to do. Dr. Daniel Kalla joins us. How are you?
Hello, how are you?
Great to be back.
Good to see you.
Okay, what are we talking about today? Sports injuries? Okay, we're going to start with ligament tears. And I know that you were making some ligaments with some electrical tape on your little bone thing there. Tell us what this is.
I'm so proud of myself. I was using duct tape to make our model here today. So this is a model of a knee, and exactly when we talked about this segment, I looked up the 5 most common skiing injuries, and I was kind of surprised myself to find that 1 and 2 are both knee injuries, at least according to a big study in the States.
That's interesting.
And that was, it was anterior cruciate tear, which we hear a lot of hockey.
Wrists.
Yeah, with the 2, I would have thought.
And shoulder, yeah.
Yeah, and shoulder, but it's both the ACL and the MCL injuries. So
okay, now I always used to get confused between, because you always hear about that one that's sort of like the career ender for athletes and stuff, and I wasn't sure, is that the ACL?
That's the ACL.
That's the ACL.
Yeah, most MCL tears. Now, so we got to talk about a little anatomy here.
All right.
Because I always just call it my knee. What is the ACL and the MCL? Are they ligaments? Is that what
They're
they
ligaments, yeah. You have 4 major ligaments that hold. As you can see, like the knee, which unlike the hip is not a ball and socket joint, it just kind of hangs together. You got the femur bone on top, the tibia below, and if I had more money, I'd have a fibula bone here.
Where's our kneecap?
Yeah,
we ran out of budget.
We ran out of budget. We blew it all on
but it
duct
doesn't
tape.
have a kneecap on it.
Well, you wouldn't be able to see the ACL if you had
Oh, God.
duct tape in there.
But as you can see, I mean, it's held together by ligaments, basically, right? There's no bone sticking in bone, so it's a very vulnerable joint. And the 2 most common injuries, this MCL is the medial collateral ligament that runs along here. I forget.
Is that the inside or the outside?
That's the inside of your knee.
Okay. Yeah.
And the ACL is the one that runs from the back of the femur to the top of the tibia bone here.
That would
and
be the black electrical tape on a diagram.
Yeah, that's the one that really sort of makes everything work,
that's the one you hear about hockey, and that's the one that's a real problem, because when you tear that, you lose stability in the joint, and the knee can slip forward like that.
I think what I've heard that surprises people the most when they have a knee injury is that sometimes there's not a great deal of pain. Like, it does hurt, but there's not like a huge amount of, oh my God, I broke my leg pain.
Well, I think we can all relate when we sprain something. You often, you go, that doesn't feel right. And then for a while it's okay. And then as the bleeding and swelling increase, it becomes more and more painful.
Right.
And that's very typical of ligament injuries.
So how do you know when you've done something that needs that sort of medical attention, you haven't just tweaked something? When your foot and your hip are pointing in different directions. Thank you. All right, that's the end of the segment. Thank you, Daniel Kalla.
One of the big signs is instability. Obviously, when your knee swells up right away.
Yeah.
Sort of the classic ACL injury, I'll put this down in a second, but is when the leg plants, and the knee moves. So this is when you're skiing, when your foot sticks in the snow and your body twists, you rip this MCL, it's called the unhappy triad. You rip the cartilage, the MCL, and the ACL. And that's...
So what is the healing process if you do that kind of damage to your knee?
That's the thing. ACL injuries often need surgery because the knee becomes inherently unstable, especially if you tear the MCL with it. But it kind of depends on who you are. If you're a high-level athlete, if you're Pavel Bure, there's no choice. You got to get your knee fixed. If you're a 50-year-old, a weekend warrior and stuff.
Say it, Mike Eckford. No. Say it. Damn it. I know what you're thinking.
I was thinking of myself.
So how do the weekend warriors deal with it?
Well, you splint it, you ice it, you're often on crutches for a while, and it will. The thing about the MCL heals naturally on its own. It rarely needs surgery. The ACL doesn't heal. When you tear it completely, it never heals.
And is that because there's no blood flow in?
Yeah, it has to do with the blood.
Exactly.
It's just it has to do with the blood flow and the makeup of the ligament.
Okay, let's talk about skier's thumb. What's that?
Skier's thumb.
Skier's thumb.
Well, skier's thumb is that classic injury when it got its name because people always used to wear straps on their poles, and they'd fall, and the strap would pull their thumb back like that. And it's a tear of this ligament in here, the ulnar collateral ligament, the ligament that holds the thumb from it's another hinge-like ligament, just like the
Right.
collateral ligament, so it prevents the thumb from going back. And that's it's happened so often with skiing because of the way you fall.
Yeah.
And you could do it falling on the ground, but it's a very
Yeah,
natural
but even if
ski
you're
injury.
holding poles, I could see how that
It
can
still
happen.
happens, exactly. So, and if it's moderate or mild, grade 1 or grade 2 sprain, it generally heals on its own. You just need to ice and splint it. Again, if you tear it completely, it can be unstable forever and need surgery. And the problem with it is because you need that thumb for the pincer grip, right? And if that's not strong and it's weak, you lose a lot of the strength in your
Right.
hand.
Okay, move
And
on
a lot
to
of the fun.
when Michael. I'm sorry, what are you getting at? Separated shoulders. I know a couple people who've done this before, and it just looks and sounds extremely painful.
You know when you've done this.
Yeah,
Yeah,
but
there's no...
it's not as painful as a dislocated shoulder, but people often confuse the two. There's a big difference between a shoulder separation and shoulder dislocation. The classic separation of a shoulder, it's a football injury when you get hit right on the shoulder or you land directly on your shoulder. And it's where your collarbone, your clavicle meets the shoulder blade, the acromion, which is a part of the shoulder blade there.
Yeah.
And what happens is the ligaments tear apart. And often you get that winging of the shoulder where the clavicle sticks up. You know,
Yeah.
if it's severe enough, I'm sure you've seen somebody. And
Yeah.
you see somebody, you see somebody, when you see enough people changing like I do, you see a lot of winging shoulders
Ouch.
from old injuries.
Yeah.
There's another one that doesn't heal if it's severe enough, but it rarely needs surgery. It usually just needs to be slung for a couple weeks.
And then you're all right.
and
But the full dislocation
a different
requires...
ball.
Yeah, you know when you...
That's where you see the grown men crying and stuff. I mean, when we see
Did you cry?
Oh, yeah. Well, no, you know what
No,
I did?
no.
This is my pain sound. When I'm really hurt,
Yeah.
that's when it's
Hey,
trouble.
maybe don't do that again.
But honestly, I remember making that noise because I
pain
actually...
sound, Mike?
Yeah.
I don't know. Let's talk about the book. When
Can
is
a
it-
man not make his pain sound without being derided and made fun of?
Let's talk about the book. When is it going to come out?
It's coming out April 13th.
April 13th. Can't wait.
And we mention it every time, but this is a bit of a departure for
Yeah.
you in terms of your writing style. This is a historical...
Well, part historical, as you know, part contemporary, part. It's just sort of a saga. I really wanted to follow this one medical family that creates this big center, and the crisis that they're happening today reflects on the crisis 100 years ago when the pioneers were trying to
so
found
there's
this.
all these stories that are sort of coming together into
Yeah.
that nice moment at the end as well. So.
Well, I can't
Beautiful.
wait to read it. Thank you so much, Dr. Daniel Kalla. Of course, this book will be coming out in April, but he's got a few more if you want to check them out.
A man's-
Pain sound?
A man.